So we've got what probably is the most common pre-surgical condition in the country, which is women's feet as a result of them trying to squeeze into shoes that don't fit and have the absolute wrong anatomic angle for them to have normal bones. Tell us a little bit about what we see there.
So women are 8 to 9 times more likely than a man to develop a foot problem as a result of shoe wear. So obviously the societal pressures on women to be in these cute shoes with the high heels and the narrow toe boxes really does produce a tremendous amount of problems with the foot in terms of pain, in terms of bunion development. We do know that bunions really don't occur in these limited populations across the country that don't ever wear shoes. In the developed countries where from birth we're all in shoes, the percentage of patients that develop bunions is 30 to 40%. So it is surprisingly common and, as Gene can tell you, very painful.
And Dr. Borden, when you have bunions, you don't always end up having to have surgery. And that surgery is pretty radical. I want you to show us in a minute a little bit about that. But what are some of the things that people can do once they start to notice that that bone is starting to bump out and it's starting to get a little tender?
Once it's starting to get tender and once they notice that it's changing, most of the time when you see it on one foot, it's usually from a trauma. So you had some type of injury there. One of the things you can do is come in to a foot specialist so that we can get you in orthotics. Basically, it's a muscle imbalance that's causing the problem. So if we can get you into custom-made orthotics so that we can control the foot and negate that imbalance of the muscle, then we can stop the bunion from forming. As Jean said, she went years and years and years watching it get a little bit worse, a little bit worse, a little bit worse, the shoes getting a little stretched out, and then finally saying enough is enough. But if you catch it early, there's a chance that the orthotics will control it and you'll never have to go to the surgery.
Okay, so you can resolve the pain, but finding style in that resolution.
Well, we have more stylish shoes now.
Okay. And we see some of them here too. We're going to look at some of them, although I don't say there are any 3-inch stilettos there, but nonetheless.
But most of us don't work in the 3-inch stilettos.
Right,
so, you know, those are for church and weddings and funerals and graduations and parties and anniversaries. And a lot of times you're not walking, 2 and 3 miles in stiletto heels.
Right.
So there's always room for the fashionable heels.
And we do have somebody who's going to tell us a little bit about how those orthotics are made too. When people do end up needing to have the surgery, now it used to be a fairly diffuse piece of surgery. You guys use minimally invasive techniques now, things that make it less traumatic to the foot itself?
So the standard bunion correction, and actually the surgery that Gene had, is basically what we call an osteotomy, which is a cutting of the bone in a redirection of this big toe bone. So instead of pointing out, to the side where it's abnormal, we can point it in a straight direction. The change in 2010 is that we're doing these surgeries with improved implants, little small plates that basically improve the patient's ability to rehab. So we're not being as strict, we're not casting after surgery, we're not confining you to crutches for 3 to 4 months. We're actually trying to get you active, walking on the heel, and get you going much sooner.
Okay. Well, and we have another interesting story, one that is not only a story but a lesson at the same time.
Yes, it is.
Dave, how did you get to meet Dr. Buchanan?
Well, I was cleaning snow off my roof on a ladder.
Ah, what a great idea.
Yes. Yeah. And lost my balance. And at the time, I had the option of either going backwards on my back and my head, which I felt was not really a good option. So I decided to go straight down, and in doing so, most of my weight landed on my left foot.
Wow, great instinct. I mean, truly.
Well,
hard to imagine you were fortunate to be able to decide that in such a split of a second.
I marvel about that, but that's exactly what happened. I have to say that, and so therefore, and then I got inside the house where my wife was, and in ensuing that, we went through getting X-rays and going to a couple of doctors. The last one of which recommended the Neufeld practice. So I went over there and met Dr. Borden. Actually, first of all, she saw me and sent me for a CT scan, and they got that, and we went back to see Dr. Buchanan, and then he recommended well, he had 3 recommendations. He said you could either leave it like it is because it will heal, but I thought I'd have arthritis, and if I did, then I didn't want that. You know, I didn't want to start that. Or you could have the minimal invasive surgery, or they could cut the heel open and do what they did before the regular surgery. So we went for the minimal invasive surgery.
That seems like a good option. Anything that says minimal and surgery in
Well,
the same
it
phrase
was.
is preferable to traditional.
And it
I
was
guess,
only
isn't it? Yes.
it was only 4 1/4-inch cuts, so I was happy with that.
And it worked.
It did very well. In fact, the only pain I had pain obviously when I realized I had dropped on my foot, and but after up to the surgery and after the surgery, I had no pain until I started physical therapy. And then, and then I realized
really?
that
Yeah.
being immobile was not the best thing for your
Right.
foot. Yeah.
It takes a little time for those things to work out. It always takes time for those things to heal. But I want to know if now he has training wheels on the ladder.
No, he's not even up on the ladder anymore.
Okay, that's what I want to hear. I think that there's a certain age above which you have to be careful. And I think that probably a lot of foot and ankle problems do occur because people have less sensation in their feet. And I guess diabetes is one good reason for that sort of thing. So, but kids typically can keep their balance a little bit better than the adults. The kind of injury he had is pretty unusual. True?
Not really. We see.
No?
I mean,
Okay.
we're the practice where
Where you see
patients
it.
that we see patients that have fallen. People that have fallen from ladders, fallen from heights and stuff. So, whether somebody's at work's on a ladder and falls off, when someone's at their house changing a light bulb and they fall off a ladder, any fall from height, and actually some of the more serious car accidents can result in the type of fracture that Dave had, which is really kind of a shattering of the heel bone.
And I guess when you land like that, you probably have to transmit some force to your back. You probably have some back injuries that occur in those situations as well.
Absolutely. It takes a tremendous amount of force to shatter a heel bone. So that, when we evaluate Dave in the office, we're checking to make sure he didn't cause a compression fracture in his spine or a tibial plateau fracture or even a hip fracture. So it's a very high energy injury.
And I imagine you were wearing shoes and you landed in the snow.
No,
No?
I cleaned off the
Oh,
driveway,
you
so
clean.
there
Oh,
wasn't,
good. That's good.
there was no snow
right.
on the driveway. Yes,
Right.
so I was. It's good to do that.
Yeah.
And I must say that I really didn't realize how bad the problem was.
injury
I mean,
was.
yeah, I didn't realize it. And in listening to the people here, I have to marvel that this is easy compared to what they've gone through.
And that's true.
It is.
You're lucky,
yes.
yeah.
So,
That's good. Well,
yeah.
good. And I imagine you wear pretty comfortable shoes now. You make sure you have the right kind of cushioning and all those sorts of things
Well,
there. Are you wearing orthotics in your shoes as well?
No,
Okay.
not,
So you're
not
pretty
yet.
good.
Not
You're
yet,
doing
but
well. That's
I
great.
am, and I walk every morning to
Okay.
keep my exercise up. And that was the thing that really disturbed me the most, is I couldn't walk until I got, through physical therapy and
Right.
could actually do some walking on my feet.
Well, and we have an even more dramatic ankle story from you.
Yeah, I've broken my ankle so many times. I didn't know over the years, I was thinking that I just had a weak ankle. My mom had a weak ankle, and I just had a weak ankle. And the last time that I actually broke it, it turned the ankle all the way around, and I had to have screws put in it. And that was before I met Dr. Buchanan. And over the years, arthritis set in, and I think when I came to Dr. Buchanan, arthritis was really bad, and he had started giving me the shots. And I believe it was like the day after Christmas, I woke up, and I could not walk at all. I was in a wheelchair, and I felt that I would have been confined to a wheelchair had it not been for the surgery that Dr. Buchanan told me that I would need.
Right. And of course, you as her daughter, you watched her over the years lose her function then.
Yes,
You watched
definitely.
as that ankle got worse and worse.
Yeah. After Christmas, we were surprised that she didn't rebound. Usually it would go bad, and then about 3 or 4 days later, it would get better. But this time, it just stayed bad, and she was in a wheelchair for about a month. Probably about a month, yeah, before the actual surgery, and then longer after the surgery.
I think Dr. Buchanan also said there were probably from birth that there were 2 bones that I didn't know about and was probably hereditary with my family.
Right. So you had some
Some
predisposition
other
to
issues
having this
that-
happen.
yes.
Did you sprain your ankle a lot when you were
Oh,
young?
I sprained it. I broke it. Yeah,